Hi everybody, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I am a nurse here at UWorld. We're so glad to have you guys here with us today. We are going to be doing a prioritization question drill set. So if you guys are new to these drill sets, what you can expect is I will pull up a question, we'll read through it together. You guys will have about 30 seconds to answer and then we will walk through why the correct answer is right. So one of the great things about doing kind of a drill set of questions focused on prioritization is we'll cover a bunch of different disease processes. So hopefully you guys will not only get some good test taking tips about prioritization questions, but also some good background knowledge on different disease processes as well. So make sure you guys use that chat. Samantha is moderating the chat for us today. So be sure and ask any questions you might have. And just to kick it off, let us know where you guys are joining us. Let us know where you are joining us from. Be sure you guys are following and sharing this session, especially for those of you on TikTok. And with that being said, let's go ahead and jump in and get started. All right. Oh, I did this last time too. Okay, prioritization tips. We're going to cover just a few general tips for you guys before we jump into the questions. But what you're going to see with these prioritization questions is a few words that are going to be bolded. So you'll see the word first, immediately, or priority. So if you see those, that's going to kind of tip you off that this is a prioritization question. So what we're looking for is the most pertinent intervention, the most serious finding, anything like that. So we can always focus on kind of like stratifying our options using the ABC method. So airway, breathing, circulation, and those are always going to go in that order. So if you're having to pick between different clients that have different conditions, you can prioritize them based on ABC. So who's having like an insecure airway, difficulty breathing, trouble with perfusion, that would be a way you could prioritize. Another way questions can be prioritized or option choices is by the nursing process. So, let's say you have a question that kind of sets up a scenario and it's like, what should the nurse do next or what should the nurse do first? Kind of based off of what you've been given in the question, if you have assessment findings, you're going to move on to the next thing, a diagnosis. So preparing a client for like a CT scan, an MRI, ECG, anything like that. So that can kind of help you order some of those option choices as well. You can also just look at what you've been given in the question and prioritize them against each other. See which one really rises to the top. And then always remember too, safety and scope of practice. Only relevant answers are going to fall within the scope of practice of a nurse. And safety is so important. We know that NCLEX is a test all about safety. So again, I hope this can be helpful. Screenshot it if you want to. Again, we'll be kind of using these approaches and these methods as we go through these questions. But just wanted to give you guys a little something extra before we jump into questions. All right, question one, let's do it. The nurse is caring for a client who is receiving mechanical ventilation. The nurse notes the low pressure alarm is sounding. Which of the following actions should the nurse take first? Option 1, section the client's airway. Option 2, administer an analytic medication to the client. Option 3, check the ventilator tubing for a leak. Option 4, verify the insertion depth of the endotracheal tube. All right, 30 seconds on the clock. Go ahead and drop those answers in the chat. Wow, it's so great to see you guys joining us from so many different places from all around the world. This is so great. We're so glad to have you guys here. And again, be sure you guys are dropping those answers in the chat. Ask us any questions you might have. And congratulations to our viewer who passed your NCLEX last Wednesday. And even better with 85 questions. That's incredible. That's so good. Well done. Good answers, everybody, too. There's a bunch coming in. We're so glad to have so many of you guys on here today. Very good. All right, so let's pull up our answers. So our correct answer on this one is going to be option 3. You guys did great. A bunch of 3s came through on the chat, so well done. Okay, so again, when we see first in here, we're going to think most important. As always, put these options in order. What are we going to do, like least invasive, most invasive? That's another way we can look at this. So whenever we have a low pressure alarm sounding on mechanical ventilation, when you see the word in general, mechanical ventilation, think of machine. tubing. So this is our client that's going to be intubated on a ventilator. So the first thing we're going to do is we're going to check the tubing for a leak. We're going to make sure everything is secure. So again, that is usually one of the main culprits of that low pressure alarm. We're going to check the tubing. You guys did so great on that one. Some of the other, I saw some people answer option 4. This is not wrong to do, to check the insertion depth of the endotracheal tube. This can mean maybe that, the tube has been misplaced, but we're going to check the ventilator tubing for a leak first. That's the first thing we're going to do. Make sure our connections are secure. So good work, you guys. All right, question 2. The nurse is caring for assigned clients. The nurse should first assess the client with option 1, cholecystitis, who has a rigid abdomen. Option 2, a bowel obstruction, who has faint bowel sounds. Option 3, cirrhosis, who is reporting amber-colored urine. Option 4, peptic ulcer disease, who is reporting epigastric pain. All right, 30 seconds on the clock. Go ahead and drop those answers in the chat. Let us know what you guys think. Let us know. Very good, very good. All right. And for all of you guys on here today, be sure you're following us on your favorite channel. We are live today on all of our channels, YouTube, Facebook, Instagram, and TikTok. For all of our friends on TikTok, make sure you guys are sharing this session. Again, the more the merrier. We want to reach as many nursing students as possible. So let us know what you think. And for you guys that have already answered and dropped these answers in the chat, let us know what approach you took to prioritizing this question. So let us know kind of what led you to this, like what approach you took, if it was an ABC, if you ordered them against each other, let us know. All right, good answers, you guys. All right, so again, you guys answered great on that one. We are worried about this client in option 1, cholecystitis, who has a rigid abdomen. So again, we're looking for what is going to indicate a complication versus what is an expected pairing with the condition. So what we're seeing in options 2, 3, and 4, these are all things that we're going to expect a client to show us or talk about or have with these conditions. But a client with cholecystitis, we are not expecting a rigid abdomen. That's going to indicate a complication. So that's one of the ways we can approach this question. So again, acute cholecystitis can be caused by gallstones or any type of biliary obstruction. Anything that's going to block those bile secretions, it's going to cause that gallbladder distension. That can cause, again, it can weaken that gallbladder wall, and that can lead to gallbladder perforation, which can then cause peritonitis or infection in that peritoneal cavity, which is what lines our abdomen. So this is life-threatening. We need to make sure and act on this immediately. Again, this can kind of cascade us into sepsis. So again, option 1, you guys did great. Well done, well done. Okay, question 3. The nurse is assessing a client who had an arteriovenous fistula created in the right forearm 3 days ago. Which of the following findings would require immediate follow-up? Option 1, pain at the fistula site rated as 4 on a scale of 0 to 10. Option 2, whooshing sound auscultated over the fistula. Option 3, 1 plus radial pulse in the right arm. Option 4, 2 plus edema of the right arm. All right, let us know what you guys think. Drop those answers in the chat. We love to see this. Good work, you guys. Good job, good job. Awesome, awesome. All right, so we had a pretty good lineup earlier this week we did on Tuesday our hematological conditions with Samantha. That's more of like a lecture type of setting. And then yesterday we did hematological questions. And then again today, prioritization questions. But this is all available on demand on our social media channels. So be sure and check it out to get some of that good learning. And I love seeing all of these answers come in. Good work, you guys. Good job. All right. Seen a bunch of different answers, but good work. All right, so our correct answer on this one is going to be option 3, 1 plus radial pulse in the right arm. So when we have a fistula, so again, immediate, we're worried about our ABCs. When we have a fistula, this is essentially like a merging of an artery and a vein. They're going to be connected to provide long-term access for dialysis. So the fistula is going to allow that arterial blood flow through a vein, which is going to increase blood flow. It's going to cause that vein wall to thicken and mature. But that's going to take about 2 to 4 months. Until then, dialysis will be given differently. But a 1+ pulse means the pulse is weak and thready. So this is going to mean that maybe the client is having an obstruction like thrombosis or stenosis or even rupture. So we're going to worry about that, especially this is in the same extremity that the fistula was placed in. So 3 days, if we have a fistula placed 3 days ago, we want to make sure that we have good open blood flow above and below that surgical site. So that's what we're going to be worried about. Our findings in options 1, 2, and 4, those are all going to be a little bit expected. But again, taking it back to the ABCs, we're worried about circulation. So that's what that pulse is going to indicate for us. So good job, you guys. All right, question 4. The nurse is assessing a client who's experiencing an acute exacerbation of asthma. Which of the following findings would require immediate follow-up? Option 1, abrupt discontinuation of wheezing. Option 2, use of accessory muscles. Option 3, non-productive cough. Option 4, difficulty speaking. All right, drop those answers in the chat. Let us know what we're gonna see, what you guys think. And again, too, after you guys answer, let us know if you guys are already using UWorld, if you guys are getting ready to take your NCLEX, if you're starting nursing school. Let us know where you are in your journey to becoming a nurse, or maybe you're a nurse already. We would love to know it. All right, a bunch of answers starting to come through. So good, you guys. Great answers, everybody. Awesome work, you guys. All right. Okay, and also after you answer, since you guys are doing so good on this one, let us know if you know what the name of this condition is. You can get bonus points, so you can earn 8 out of 7 today. Good work, you guys. Awesome, awesome. All right, so our correct answer on this one is going to be option 1, abrupt discontinuation of wheezing. So in this one, if we're talking about our ABCs, we are worried about our airway and breathing. So when we have abrupt discontinuation of wheezing for a client who's having essentially an asthma attack, we're worried about silent chest. So this is life-threatening. Typically when we hear wheezing, that means we still have air passing. But if we have no sound, that means air is obstructed. So that's a big concern. We definitely need to intervene. We need to administer medication, secure the airway, all of that good stuff. So that is definitely going to be our most concerning finding. What we're seeing in options 2, 3, and 4, we're going to expect to see those with an asthma attack. Those are things that, unfortunately accompany an asthma attack, but we're definitely not expecting an abrupt discontinuation of wheezing. Wheezing, yes, we would expect, but not stopping of wheezing. That would be not good. All right, good work, you guys. Question 5. The nurse has been advised that a client with tumor lysis syndrome has hyperkalemia. It would be a priority for the nurse to Option 1, administer IV potassium chloride. Option 2, initiate continuous cardiac monitoring. Option 3, prepare the client for hemodialysis. Option 4, monitor the client's serum glucose level frequently. All right, very good. Oh, so good to see everybody that's already using UWorld already. We hope it's helping you. And if you guys are using it, let us know what your favorite feature is. Do you guys like flashcards, lecture videos, the digital notebook? There's so many great aspects, or our rationales, which is really like the essential element of UWorld, our awesome illustrations. Yeah, let us know what you guys think. Awesome, awesome. Very good, you guys. Good answers, a bunch of answers coming in today. Very good. All right, I'll give y'all about 5 more seconds and we will pull up the right answer. Oh, lecture videos, I love to see that. Our team has worked so hard on those and we hope they can be helpful. We have so many of them, over 300 available for you guys. All right, so our correct answer on this one is going to be option 2, initiate continuous cardiac monitoring. Okay, so let's talk a little bit about what tumor lysis syndrome is, and hopefully this will help kind of key in that right answer. So tumor lysis syndrome happens when we have like a pretty heavy tumor burden in the body. So whenever we initiate treatment, you can kind of think of these, chemotherapy attacking not only the cancer cells, but our other cells as well. When those cells are attacked by the chemotherapy, you can think of them as like balloons, and those intracellular components, that chemo is going to pop the balloon, those intracellular components are going to be in your bloodstream. So potassium is a big one. So hyperkalemia is definitely something that can happen with tumor lysis syndrome. We know potassium, anytime it's elevated in our blood, we really worry about our heart. We worry about those dysrhythmias. So we definitely need to be sure our client is on continuous cardiac monitoring. We need to monitor for, VTAC, VFib, all the progression to those life-threatening arrhythmias. We definitely need to be sure that we're addressing that, and that's our priority. We're not going to increase potassium for a client that already has high potassium. We're not going to do dialysis just yet. We need to look at the heart first. So again, this is a C in our ABC. And glucose, we're not really worried about at this point. So good job. You guys did great on that. Well done. All right, question 6. The nurse is caring for a newborn who was born 1 hour ago via cesarean birth. Late decelerations with absent variability were noted during labor, and the umbilical arterial blood pH is 6.9. Which of the following actions would be a priority for the nurse to take? Option 1, prepare the newborn for therapeutic hypothermia. Option 2, prepare to administer IV 5% dextrose in water. Option 3, prepare to administer anti-seizure medication. Option 4, prepare the newborn for metabolic screening. All right, drop those answers in the chat. Let us know what you guys think. Very good, very good. All right. I love seeing all the people, all the different elements of UWorld that you guys like. This is really cool. I love that. Good answers, you guys. All right. And again, before we're done today, drop any other subjects you'd like to see. We're always growing and developing our content calendar for y'all. So let us know what tests you have coming up. If it's your NCLEX, let us know, and we will be sure and try and incorporate those topics the best we can for you guys. All right. So our correct answer on this one is going to be option 1, prepare the newborn for therapeutic hypothermia. So, what we're seeing, again, in some of these options are going to be expected findings for the intervention. So, we're going to look for what's indicating a complication. So late decelerations on fetal monitoring and an acidic arterial blood pH, which is what we're seeing with a pH of 6.9. These are signs of inadequate fetal oxygenation, and they're going to be kind of indicative of that perinatal asphyxia. So perinatal asphyxia can lead to a range of poor cognitive outcomes in the newborn, such as learning disabilities, hypoxic ischemic encephalopathy, and cerebral palsy. So newborn assessment findings that are associated with this, they're going to look like a low APGAR score, neonatal seizures, and acidemia, which is what we're seeing here. So therapeutic hypothermia, this is going to be an appropriate intervention for a newborn with this kind of situation going on with this perinatal asphyxia. So therapeutic hypothermia involves lowering the body temperature of the newborn either through cooling blankets or a cap, and it can limit the damage of that hypoxic brain injury. So essentially, the cold therapy, it's going to limit the swelling of the brain, and it's going to help reduce complications associated with brain inflammation in the newborn. So a really kind of innovative treatment. This is also done in adult clients as well, and has been shown to be beneficial. So this is, it's beneficial in newborn clients as well. But again, you guys did great on that one. Well done. What you're seeing in option 2, this would be treatment for hypoglycemia. Option 3, this is correct, but it's not the priority intervention. And then we are going to do newborn screening, but we're not going to do that right now. We need to prioritize the client's brain inflammation at this point. All right, last question. The nurse is caring for a client who's experiencing Addisonian crisis. It would be a priority for the nurse to, option 1, give IM hydrocortisone, option 2, begin IV fluid resuscitation, option 3, check capillary blood glucose, option 4, provide a high-protein meal. Drop those answers in the chat. Let us know what you think. And again, a refresher on our schedule before we're done today. We are live Tuesday, Wednesday, and Thursday. Tuesday, we're live at noon Central Time, and you'll hear from Samantha on more of a lecture format. And then Wednesday and Thursday, we do question drill sets at 3 p.m. Central Time. Again, you can find us on your favorite social media channel, and these sessions are always available on demand. If you join late, or if you want to go back and do some practice questions, there's plenty of resources available for you guys on all of our channels. So we hope you'll check it out. And for anyone that was new to this today, we're so glad to have you here. We welcome you into the UWorld community. We hope you'll check out our website too. We have a ton of great information for you guys. All right, so our correct answer on this one is going to be option 1, give IM hydrocortisone. So Samantha did a really great lecture on Cushing's versus Addison disease. And so we kind of compared and contrasted those. And this is definitely, if you need some refresher information on it, go check that out. It was very good. But again, Addisonian crisis or Addisonian disease is hypofunction of the adrenal cortex. So we're going to have low corticosteroids, so low cortisol, low aldosterone, low androgens, decreased aldosterone, which has to do with sodium and water retention, and then again, low androgens is going to be, it's a key hormone in the sexual development and human growth. So again, an extreme kind of presentation of Addison disease is going to be Addisonian crisis. So the body's stress response is so low that it can't come close to meeting the demand for these stress hormones. So we're going to give that IM hydrocortisone and aggressive IV fluid resuscitation. But the first thing we have to do is give that IM hydrocortisone. Those are definitely the things we're going to do. So you guys did great on that one. Well done, you guys. As always, thank you for joining us. Check out our website at nursing.uworld.com. We're so glad that you guys joined us today. You can always check us out. We have a 7-day free trial with a great selection of our questions, videos, animations, illustrations. You can really get a good sense of what UWorld's all about. But check us out, and we look forward to seeing you guys next week, and have a great weekend. Bye.